Medical Surgical Mastery 100 True or False Statements for Next Gen NCLEX Success. You need to get comfortable with medical surgical nursing, and in this video, you can test your med-surg knowledge to determine whether the 100 statements are true or false. After each statement, I'll pause briefly, but feel free to pause the video if you need more time to think about it. Track your scores and try again after a couple of days to measure your improvement. Ready to start? Statement 1. Psoriasis presents as itchy and scaly patches noted on the skin. This statement is true. Statement 2. A dark blue or black colored stoma indicates circulatory issues after an ileostomy. This statement is true. Statement 3. Hypocalcemia is an urgent concern in a client diagnosed with multiple myeloma. This statement is false. Hypercalcemia is an urgent concern in a client diagnosed with multiple myeloma. Statement 4. Diabetes insipidus occurs when there is too little ADH being produced by the posterior pituitary gland. This statement is true. Statement 5. A client in contact with poison ivy should not shower immediately and should go to the emergency department. This statement is false. A client in contact with poison ivy should shower immediately and does not need to go to the emergency department. Statement 6. Addison's disease affects the adrenal glands, causing them to not produce enough cortisol and aldosterone. This statement is true. Statement 7. Myopia, astigmatism, and hyperopia are examples of reflective errors. This statement is false. Myopia, astigmatism, and hyperopia are examples of refractive errors. Statement 8. An early sign of diabetic ketoacidosis is polyuria. This statement is true. Statement 9. Compartment syndrome is a serious condition that occurs with a buildup of excessive pressure inside an enclosed muscle space in the body. This statement is true. Statement 10. Ultraviolet radiation from sunlight is a major risk factor of basal cell carcinoma. This statement is true. Statement 11. Cushing's syndrome occurs as a result of excessive production of cortisol by the pituitary gland. This statement is false. Cushing's syndrome occurs as a result of excessive production of cortisol by the adrenal cortex. Statement 12. The largest gland in the body is the pituitary gland. This statement is false. The largest gland in the body is the liver. Statement 13. Addisonian crisis is caused by acute adrenal insufficiency, which is life-threatening. This statement is true. Statement 14. Syndrome of inappropriate antidiuretic hormone secretion occurs when there is a very little amount of ADH being produced. This statement is false. Syndrome of inappropriate antidiuretic hormone secretion occurs when there is an excess amount of ADH being produced. Statement 15. Skin is still intact in stage 2 pressure injury. This statement is false. Skin is no longer intact in a stage 2 pressure injury due to the partial thickness skin loss of the dermis. Statement 16. Ulcerative colitis starts at the rectum and ascends towards the colon, causing an inflammation. This statement is true. Statement 17. Cataract and glaucoma are examples of intraocular disorders, which are eye disorders that occur inside the eyeball. This statement is true. Statement 18. Abdominal palpation should be avoided with a client diagnosed with pheochromocytoma. This statement is true. Statement 19. The pineal gland is the smallest gland in the body, which is a part of the endocrine system. This statement is true. Statement 20. Topical glucocorticoids does not get absorbed into the systemic circulation. This statement is false. Topical glucocorticoid does get absorbed into the systemic circulation. Statement 21. Fluid and electrolyte imbalances should be monitored when a client is receiving enemas. This statement is true. Statement 22. Pain caused by duodenal ulcer is often alleviated after a meal. This statement is true. Statement 23. The client should not lie down after meals to prevent rapid gastric emptying. This statement is false. To prevent rapid gastric emptying, the client should lie down for 20 to 30 minutes after meals. Statement 24. Cholecystectomy is the removal of the kidney. This statement is false. Cholecystectomy is the removal of the gallbladder. Statement 25. Tinnitus indicates systemic toxicity and the client prescribed with salicylic acid. This statement is true. Statement 26. Macular degeneration and hypertensive retinopathy are examples of retinal disorders, which are eye disorders that affect the innermost eye layer. This statement is true. Statement 27. Informed consent should be obtained prior to any invasive procedure. This statement is true. Statement 28. The major complication of pulmonary contusion is acute respiratory distress syndrome. This statement is true. Statement 29. Hyperpituitarism can be treated with hormone replacement therapy. This statement is false. Hypopituitarism can be treated with hormone replacement therapy. Statement 30. The definitive diagnostic testing of cancer is biopsy. This statement is true. Statement 31. The client should be NPO prior to a lung biopsy. This statement is true. Statement 32. Hepatic encephalopathy and ascites are potential complications of cirrhosis. This statement is true. Statement 33. Droplet precautions are required for a client diagnosed with active tuberculosis. This statement is false. Airborne precautions are required for a client diagnosed with active tuberculosis. Statement 34. Hyperkalemia can lead to cardiac arrhythmias. This statement is true. Statement 35. The major cause of death in an immunocompromised client is myocardial infarction. This statement is false. The major cause of death in an immunocompromised client is infection. Statement 36. Fluid overload should be monitored in clients diagnosed with heart failure. This statement is true. Statement 37. Muscle weakness, hypotension, and bradycardia are signs and symptoms of hypomagnesemia. This statement is false. Muscle weakness, hypotension, and bradycardia are signs and symptoms of hypermagnesemia. Statement 38. Airborne precautions are required for a client diagnosed with latent tuberculosis. This statement is false. Airborne precautions are not required for a client diagnosed with latent tuberculosis. Statement 39. Vasopressin antagonists may be prescribed to decrease overproduction of ADH. This statement is true. Statement 40. Vaginal bleeding after hysterectomy should be monitored for excessive bleeding. This statement is true. Statement 41. Holter monitoring is an invasive test to identify dysrhythmia. This statement is false. Holter monitoring is a non-invasive test to identify dysrhythmias. Statement 42. Cardiac catheterization is an invasive procedure in which a catheter is inserted into the chamber or vessel of the heart to examine the heart. This statement is true. Statement 43. Morphine should be administered to a client experiencing a myocardial infarction for pain relief. This statement is true. Statement 44. Hyperpituitarism, also known as acromegaly, occurs when there is a hypersecretion of growth hormones. This statement is true. Statement 45. The unaffected arm should be elevated after a mastectomy to prevent lymphedema. This statement is false. The affected arm should be elevated after a mastectomy to prevent lymphedema. Statement 46. Accumulation of fluid in the pericardial sac is a condition known as cardiac tamponade that requires immediate medical attention. This statement is true. Statement 47. Anticoagulation therapy is required for a lifetime in clients with mechanical heart valve. This statement is true. Statement 48. A decrease in blood pressure and increased pulse rate are signs of hemorrhage occurring. This statement is true. Statement 49. Oxytocin is a hormone that is released from the anterior pituitary. This statement is false. Oxytocin is a hormone that is released from the posterior pituitary. Statement 50. Airway should be prioritized for a client with laryngeal tumor. This statement is true. Okay, that was the first 50 true or false statement. You can get a glimpse of how effective my digital flashcards are for true or false statements like these when you go ahead and grab your 160 free digital flashcards at cutieNurses.com/start. While you're here, smash that red subscribe button below to stay updated with all of our latest insights and tips. Let's get NCLEX ready together. Alright, on to statement 51. Embolectomy is performed to remove an embolus, which is causing blood flow obstruction. This statement is true. Statement 52. Blood pressure is regulated by the gallbladder that secretes renin. This statement is false. Blood pressure is regulated by the kidneys that secrete renin. Statement 53. Meniere's disease can lead to vertigo and hearing loss. This statement is true. Statement 54. Hyperuricemia is noted in a client diagnosed with gout. This statement is true. Statement 55. Signs of decreased cardiac output are hypotension and dizziness. This statement is true. Statement 56. The nurse should remove the object that is penetrating the eye as soon as possible. This statement is false. The healthcare provider should remove the object that is penetrating the eye. Statement 57. Liver function tests should be performed to watch out for hepatotoxicity when a client is taking diazepam. This statement is true. Statement 58. Signs of renal impairment should be monitored in a client diagnosed with systemic lupus erythematosus. This statement is true. Statement 59. Goodpasture syndrome, which is a rare autoimmune disorder, can lead to glomerulonephritis and pulmonary hemorrhage. This statement is true. Statement 60. A client with chronic kidney disease should have a high phosphorus diet. This statement is false. A client with chronic kidney disease should have a low phosphorus diet. Statement 61. The ring-shaped rash occurs in all clients with Lyme disease. This statement is false. The ring-shaped rash sometimes does not appear on clients with Lyme disease. Statement 62. Allopurinol is prescribed for a client with rheumatoid arthritis. This statement is false. Allopurinol is prescribed for a client with gout. Statement 63. Non-steroidal anti-inflammatory drugs are the common drugs used to address musculoskeletal pain. This statement is true. Statement 64. Alendronate is prescribed to prevent or treat osteoporosis. This statement is true. Statement 65. Arteriovenous fistula has a higher rate of infection than a catheter in a client receiving dialysis treatment. This statement is false. Arteriovenous fistula has a lower rate of infection than a catheter in a client receiving dialysis treatment. Statement 66. The healthcare staff should stand at the unaffected side of the client when providing ambulation assistance. This statement is false. The healthcare staff should stand at the unaffected side of the client when providing ambulation assistance. Statement 67. Pulselessness is a later sign of compartment syndrome. This statement is true. Statement 68. Special precautions are required after a bone scan. This statement is false. Special precautions are not required after a bone scan. Statement 69. There is no cure for multiple sclerosis, which affects the central nervous system. This statement is true. Statement 70. Complications of hemodialysis treatments include hypotension, sepsis, shock, and disequilibrium syndrome. This statement is true. Statement 71. Anti-myasthenic medication are administered for the treatment of myasthenia gravis, which is a lifelong therapy. This statement is true. Statement 72. Respiratory difficulty, dysphagia, and muscle weakness is noted in a client with amyotrophic lateral sclerosis, which is an incurable degenerative disease. This statement is true. Statement 73. Parkinson's disease is cured with levodopa combined with carbidopa medication therapy. This statement is false. Parkinson's disease does not have a cure, but it is a progressive neurological disorder. This is managed by medication therapy, which is levodopa combined with carbidopa. Statement 74. Auditory center is regulated by the parietal lobe. This statement is false. Auditory center is regulated by the temporal lobe. Statement 75. Cloudy fluid that is being drained out of the abdomen after the exchange process during peritoneal dialysis is an early sign of peritonitis. This statement is true. Statement 76. The second cranial nerve is the oculomotor nerve, which affects vision. This statement is false. The second cranial nerve is the optic nerve, which affects vision. Statement 77. Glaucoma is a chronic condition that requires lifelong treatment. This statement is true. Statement 78. The most common symptom of digoxin toxicity is gastrointestinal upset. This statement is true. Statement 79. A client with heart failure that presents with lung crackles and tachycardia is experiencing pulmonary edema. This statement is true. Statement 80. An early sign of peritonitis is acute abdominal pain and abdominal distension. This statement is true. Statement 81. The leading cause of peripheral artery disease is chronic obstructive pulmonary disorder. This statement is false. The leading cause of peripheral artery disease is atherosclerosis. Statement 82. A client that is experiencing an acute asthma episode should be placed in a side-lying position. This statement is false. A client that is experiencing an acute asthma episode should be placed in a high Fowler's position. Statement 83. Crohn's disease is a chronic inflammatory bowel disease that affects the digestive tract lining. This statement is true. Statement 84. Hemianopsia is blindness in the entire visual field. This statement is false. Hemianopsia is blindness in half of the visual field. Statement 85. Acute pyelonephritis can lead to acute kidney infection. This statement is true. Statement 86. A mydriatic medication is given for pupil constriction. This statement is false. A mydriatic medication is given for pupil dilation. Statement 87. Tonometry is a test to screen for glaucoma and to measure the effectiveness of glaucoma treatment. This statement is true. Statement 88. To test cranial nerve 7, which is the facial nerve, the client should be instructed to close the eyes tightly, smile, and frown. This statement is true. Statement 89. Transverse fracture is when the bone is fractured perpendicular to its length, which is the straight line that occurs in the opposite direction of the bone. This statement is true. Statement 90. Benign prostatic hypertrophy usually affects adolescents. This statement is false. Benign prostatic hypertrophy usually affects clients that are 50 years or older. Statement 91. Hearing loss, pain, and headaches are seen in mastoiditis, which is an infection of the mastoid bone. This statement is true. Statement 92. Check if the client is pregnant before performing radiographic procedure. This statement is true. Statement 93. The lowest possible score on the Glasgow Coma Scale is 1. This statement is false. The lowest possible score on the Glasgow Coma Scale is 3. Statement 94. Trendelenburg's position should be avoided in an unconscious client. This statement is true. Statement 95. Fever is usually noted in a client diagnosed with pyelonephritis. This statement is true. Statement 96. West Nile virus infection can affect the central nervous system, causing severe neurological disease. This statement is true. Statement 97. An extremity with a cast should be elevated after the first 24 to 48 hours to reduce swelling. This statement is false. An extremity with a cast should be elevated during the first 24 to 48 hours to reduce swelling. Statement 98. Low back pain radiating down a lower extremity is usually noted in a client with a herniated lumbar disc. This statement is true. Statement 99. An early sign of fat emboli is an altered mental state. This statement is true. And last but not least, statement 100. The normal IOP, which is intraocular pressure, ranges between 1 to 10 mmHg. This statement is false. The normal IOP, which is intraocular pressure, ranges between 10 to 21 mmHg. You made it through these 100 true or false statements. You're nailing med-surg nursing like a champ. I hope you kept track of what you got right or wrong, so next time you take this exercise, you can track and celebrate how much you've improved. Before you go, I got something else lined up for you. Check out this next video right here. It's packed with more invaluable insights and tips that you won't want to miss. Remember to hit that red subscribe button to keep supporting our channel. Keep up the great work, and I'll see you in the next video. Happy studying!